In this video, we will explore OET Speaking Task 1. Today, we are diving deep into the Task 1 of the OET Speaking Test in OET. If you're preparing for this exam and aiming for a B grade or higher, so this video is going to be incredibly helpful because we are not just talking about the theory. We will go through everything step by step, what the task is about, its structure, what the examiners actually test, key communication strategies, and with examples. Okay? So in the OET speaking test, you will complete two role plays with an examiner. During the role play, you take the role of a healthcare professional, for example, a doctor, nurse, pharmacist, physiotherapist, dentist, or other healthcare worker, depending on your profession. The examiner will act as the patient or the patient's caregiver. Now, here is the key idea. This is not just a language test. It's a professional communication test. The examiners wants to see whether you can communicate clearly, politely, professionally, and empathetically in a real healthcare situations. So task 1 usually focuses on situations such as explaining a medical condition, discussing symptoms and diagnosis, explaining tests or procedures, reassuring worried patients, giving initial advice. Okay, so in simple terms, task one checks whether you can communicate medical information clearly while maintaining patient centered communication. So here is the structure of OET task one. Each role play follows this structure. Preparation 3 minutes and role play interaction will be for 5 minutes. During the 3 minutes preparation, you receive a role play card. On this card, you will see the setting. For example, hospital, clinic, outpatient department, community pharmacy. So information about the patient, the patient's concern, bullet points describing what you must do during the conversation. All these things you can see in the card. So during the 5 minute role play, the examiner will start the conversation and you must guide the interaction according to the points on the card. So think of it like a real patient consultation. Okay. And many candidates think this test check medical knowledge. No, that's not the main focus. This test evaluates communication skills. Examiners assess two main categories. First one is the linguistic criteria. These include intelligibility, fluency, language, and pronunciation. When we say intelligibility, that means are you easy to understand? And fluency, yes, do you speak smoothly without long pauses? And language, are you using appropriate grammar and vocabulary? And when it comes to pronunciation, are your words clear or not? And then comes the clinical communication criteria. So, this is the most important part. It includes relationship building, understanding the patient's perspective, providing structure to the conversation, information gathering, information giving, encouraging patient involvement. So, here your goal is not to sound like a medical textbook. Your goal is to sound like a professional healthcare worker speaking to a patient. Okay? Now, let's talk about the core communication concepts that strong candidates use. Kindly make a note of it. The first and foremost thing is the empathy. Patients may feel worried, confused, or anxious. So you have to keep the phrases like these. Like, I understand that this might be worrying for you. That's a very common concern. Let me explain it in a simple way. So your empathy immediately builds the trust here. Okay. Next one is signposting. Signposting helps organize your explanation. For example, first, let me explain what this condition is. Next, I'll talk about the treatment options. Finally, I'll explain what you can do at home. So, this makes your communication clear and structured. And the next one is checking understanding. Never assume the patient understands everything. Instead, say things like, does that make sense? Do you have any questions so far? Would you like me to explain that again? So, this shows patient centered care. Okay? And avoid complicated medical terms. Use simple language. Instead of hypertension, you might say high blood pressure. Instead of gastroenteritis, you might say a stomach infection, right? So try to use a very simple patient language. And let me tell you some of the practical strategy for this task one. First one is start with rapport. Always begin politely. For example, hello, I'm Dr. Sharma. I understand you have been experiencing some discomfort. How are you feeling today? So, this type of communication immediately builds the connection. And the next strategy, you have to acknowledge concerns. If the patient is worried, you have to respond with empathy. For example, I can understand why that might be concerning. Okay. And third one is try to break information into simple steps. Never give long, complicated explanations. Instead, you can say, let me explain this step by step. Okay. And strategy four, you have to encourage questions, always welcome questions from the patient. Patients feel more comfortable when you ask questions. Okay. Please feel free to stop me if anything is unclear. So, this is a kind of example. So, this way you can use it. And the next one is end with clear next steps. Always finish with guidance. For example, we will start with this treatment and we will review your progress next week. This is just an example I'm giving you. So, these type of sentences you can frame. Here is a role play prompt. Setting as the community clinic, your role as a nurse, patient, a worried parent. Situation is a child has been diagnosed with mild asthma. The parent is concerned and wants to know what asthma is, why the child has breathing problems, whether it is dangerous, what treatment is required. And your task is you have to explain asthma in simple terms, reassure the patient, explain how the inhaler works, and you have to give advice for managing symptoms. Okay, so let me start my response here. Now imagine the role play starting like this. The examiner is asking you, I'm really worried about my child. Doctor said he has asthma. What does that mean? Now you have to respond like, hello, I completely understand your concern. It's very natural for a parent to feel worried when they hear a medical diagnosis. Let me explain what asthma is in a very simple way so that you can better understand what's happening. Basically, asthma is a condition that affects the airways in the lungs. So, the airways are the small tubes that carry air in and out when we breathe. In children with asthma, these airways can sometimes become narrow and inflamed. When that happens, it becomes harder for air to move through, which is why your child may experience symptoms like coughing, wheezing, or shortness of breath. But the good news is that asthma is a very common condition, and in most cases, it can be managed very effectively with the right treatment and care. Is it dangerous? I understand why you might think that, but in most cases, asthma is not dangerous when it is properly managed. Many children with asthma live completely normal and active lives. The key is learning how to control the symptoms and knowing what to do if your child starts having breathing difficulties. The doctor mentioned an inhaler. How does that help? That's a great question. The inhaler contains medication that helps open up the airways in the lungs. When your child uses the inhaler, the medicine goes directly into the lungs. So, this helps reduce inflammation and relax the airway muscles, making it easier to breathe. We will also show you exactly how your child should use the inhaler so that the medication works effectively. Is there anything I should watch out for? Yes, there are few things that can sometimes trigger asthma symptoms. For example, dust, cold air, strong smells, or respiratory infections. So, it's helpful to keep the environment as clean as possible and make sure your child avoids known triggers when possible. But please remember, asthma is manageable and we will support you and your child throughout the process. Do you have any other questions or concerns that you would like me to address? Now, let's analyze why this response works well. If you see, we told that I completely understand your concern, right? So this immediately acknowledges the parent emotions. And we have given clear explanation. Instead of using complicated medical language, we clearly explained what an asthma is. And also, we have reassured the parent that asthma is very common and manageable, right? So, this will reduce their anxiety. And also, we have encouraged interaction, so that shows patient centered communication. Got it? So always sound natural and conversational. Do not memorize long scripts. Instead, you can focus on clarity, empathy, structure, patient involvement. If you communicate like a real healthcare professional who cares about the patient, then you will perform very well. So that's all for today's video. Kindly like, share, and subscribe for more OET tips. See you in the next video. Bye bye.